Welcome back, everyone, to our second segment. Thank you for sticking with us. And in keeping with the theme of leeks today, I'm going to give you a few health benefits of leeks before we get into Dr. Alfonsi's RX food. So here we go. One of the amazing benefits of leeks is that it can protect your heart health. It can also increase the strength of your immune system. It's vital for the health of our nervous system, which I could use a little bit of regulation in that department these days.
Indeed.
They improve your vision. You would have been able to read what was on the screen if you had eaten more leeks.
Yes.
Hello. Reduce the risk of cataracts.
There we go.
I don't have those. Lower blood pressure, improve digestion, and they're natural diuretics.
Interesting.
There are more, and I know you're all sitting on the edge of your seat waiting for more leak details, but
yes,
I think for now, we're going to segue into Dr. Alfonsi's RX food program. So if you could just give us a little bit of information about that, it'd be amazing.
For sure. And so, this is something, I talked about in the last segment, a couple of colleagues of mine who were from the patient perspective, kind of challenged with understanding some aspects of nutrition and trying to figure out how technology could maybe help with that. And so they had come to me when I was in residency. As I said, I thought it was really valuable because of the limitations I had. And so we then came together and interviewed a whole bunch of patients or people living with chronic disease, as well as clinicians in different centers caring for people with chronic diseases. And we really found that there was, a problem from both ends, saying, it's really hard to kind of track or understand what I am eating from that individual perspective and to interpret that. And from the clinic perspective, they were saying it is hard for us to get information on how someone's eating. And so if often, approximate here or estimates of that, but sometimes it's difficult to give that real personal suggestions and feedback. And so we thought there was a need to kind of bring some technology in that really was, revolutionary and helpful to solve that problem. And so that was how RX Food was born. And so the idea is to kind of really radically change the way that people are able to enter what they're eating. And so instead of having to write down a piece of paper or type through a database and try to find, one of 14 versions of orange juice and estimate the size and type it in, to make it as simple as just being able to take a picture of your food and then using technology to figure out what's in it, the approximate size. And then we'd always say is also trying to look at it from the lens of a dietitian to extract diet quality aspects, we say. So, is it whole wheat bread or how are things cooked, right? So trying to take all that information as easy as possible, just through pictures in the vast majority of cases, and then being able to present that information back to whether it be the individual or the clinical team in a way that makes sense. And so we're kind of, even the Canadian Food Guide is shifting away from just numbers. A lot of people say, how many calories, how many grams of protein. That can be extremely challenging for people to actually estimate this and to look at. So it's more, again, with the food guide, the idea is, what does your plate look like? Are you setting it up right? How many times are you eating these sorts of foods, right? So it's trying to make it a bit more practical. And when you think about a lot of the chronic disease guidelines, which come up with, the best ways to manage things like high blood pressure, diabetes, et cetera, they're really, they do all have a component of medical nutrition therapy, they called, and they come up with some information that's, again, watch how many times you drink sugary drinks a week or look for these types of whole grains. So it's a practical kind of categorization of food. And so when we think again about if we track and get numbers, if someone has, 2,000 calories of food, I mean, it could be very different between one that's, maybe more optimally aligned to control diabetes versus one that's highly processed. And there's really no way to tell just from the numbers. You have to kind of go deeper into that quality. And so that's what RX Food was really about, is how do we capture that information in a way that's very easy, but be able to present that information back to really help understand care. And so it can help the individual better understand their diet, how they're eating, and how that links to how they're feeling, or perhaps their chronic disease control if they're trying to take care of a chronic disease. And from the clinician perspective, can we save a lot of time, help them get to information faster so they can spend more time actually talking about what we can do about it instead of trying to gather, approximate estimates of food intake. So that's really what RX Food technology originally started out as. And then from there, we've continued to kind of evolve it and expand out into different use cases and from there. So lots of really exciting stuff.
Now, I do see on your website that you're partnered with, different hospitals and organizations like Diabetes Canada. Tell us a little bit about how you're starting to grow this technology and how it's being implemented currently. Can you give us some live examples about how it's actually being used right now?
Yeah, for sure. So a lot of times, we started in a diabetes clinic, and so we've always, that's been kind of our start, and we've got a lot of kind of expansion within diabetes. And so, in that case, it all depends a little bit on the clinic and the individual being cared for. But in general, some of the common ways that's really helpful is when someone is newly diagnosed with diabetes, for example, a big part of it, they may have to start understanding carbs, like how do I count or estimate the amount of carbs in my food. And and for some cases, when people are being started on insulin, that also may become really important because they have to match the insulin in some cases to kind of the amount of carbs, or if they're having more carbs than normal. So these can be pretty tough times, because in addition to all the other stress about being diagnosed with a chronic disease, everything you eat in some way can be maybe anxiety provoking, or areas that you have to kind of understand or track. And so that was one of the big points that people said is, you could help with that. And so in addition to it, being able to track that information and kind of share that back with your clinician, which is really important early on when you're newly diagnosed. It's a burden. It's really hard. And so that's where we find the technology has been really helpful, is that by taking pictures of your food, you can get some information on the net carbs, so kind of a bit of a guidance for you to check, but also document it all in a way that can be shared with your clinical team. So it just really made that a little bit easier. And in one of the research studies we did, the individuals in the study were able to count carbs more accurately from being able to have access to this. So I think that was one way that helped with self-management, which was really fantastic. The other thing that we're doing that we're really excited about, it's really neat and a new area, is actually being able to combine what you're eating with your glucose response. And so in this case, if people are wearing a continuous glucose monitor, which will measure your glucose and provide you that kind of almost real-time guidance on what's happening with your blood glucose. And also you can take pictures with RX Food, and it will put those two together. And where that's been really helpful is it lets people reflect back and say, hey, when I ate this particular breakfast in this way, and of course there's other factors that you may come into play, like exercise and your medication, but you can say, hey, look, my sugars were actually quite stable there. My blood glucose response was really good. But then this meal, it went a little bit higher. And that could just be a great starting point to reflect, to take this back to your clinical team, your educator, and say, look, what's the difference here? Like, can you help me understand why? And then you get into some of the details. And there's a lot of kind of education that happens around diabetes, but when you see your response, it becomes that experience can be really powerful. And so we found that the initial research in that was it really helped people understand their personal response a little bit. And it was a really helpful way to help with that learning, self-management, as well as to have more really great discussions with the clinical team. So those are some examples in the diabetes space, a whole bunch more kind of in primary care and prevention and osteoporosis, and even starting to talk with some specialists in women's health about nutrition there. So there's a lot of areas when you think about nutrition. And so getting that information in is the same, but you might just reflect it back a little bit differently, and it can have kind of different kind of use cases from there.
Oh, I love what you're saying, because, here we're always talking about becoming the CEO of your health and patient self-management. There's never been, and I'm sure you'll agree with us, there's never been a more important time that the everyday person feels more empowered to advocate for themselves, but also to take control of their health. Sometimes, and certainly with diabetes, it can be so overwhelming. I'm thinking of my daughter's girlfriend who's diabetic, and it's a roller coaster when you're trying to figure things out as a young woman in university, and all the things that go with that. And having a technology tool like this that helps to put some control back in her hands takes away some of that fear, because, she talks a lot about that, the anxiety and fear that comes with when her diabetes is not under control. I mean, her friends know this. They know when she's not feeling well or when her sugars are off. I just love that you're doing work that's having such a rippling effect and impact on the control that people feel in their own health, which to me is a massive win as well, not only on the health benefits, but it's a massive win for the way you're making people feel empowered.
I was just going to say that it's a very empowering thing to have to face this new diagnosis and then to try and manage it yourself.
Yes.
Your doctors can't always be there. Your healthcare team can't always be there. So to be able to feel like you could match up these things together and feel like you can do this, like I can do this, I can get through this. And, I think that's amazing.
That's fantastic.
What a fantastic tool.
And of course, we're going to dive in more we want to hear more about other areas, because we have an interest, certainly in women's health and in bone health. It's so critically important. When you talk about primary care and in the hospital, and so I know that you're partnered with Women's College Hospital. I see that Sick Kids is on there as well. Is that correct?
Those are the groups that are using RX Food. Yeah, different people at those centers are using them. Exactly. Yeah.
That's fantastic. So was there a plan to grow that across the country or even internationally? I'm kind of curious about where that's heading.
Yeah, absolutely. I mean, we continue to grow and we already have people working across like clinics and specialty groups across North America, and starting to look at other regions. And so always looking for great partners, champions, and those interested. So yeah, absolutely. We think that's one of the great advantages of technology, is that it can be scaled out. And so, yeah, our goal is to continue to expand it out as fast as we can so that more people can have access to it.
Well, we're certainly going to have take some photos and things so that we can show people in social media as well, the app and more about Food RX. But we're going to take a break here in a moment, and we're going to come back and talk a little bit more about the role that food can play in medicine, maybe go down the path a little bit of women's health, and of course something that we're really passionate about, bone and musculoskeletal health, the foundation of health. Movement is medicine, and so is food. So stay tuned. We're going to be back here in a moment at PHAMCAST, so we'll be right back.